Healthcare dominates the Texas economy. If you look on the jobs for Texas, the number one job is RNs in this state. The population of Texas is booming, and these people are coming from Chicago and New York and LA, and then they're diluting our values. And I feel like the fact that mandates started in Texas was very purposeful. I feel like it was strategic. I feel like they knew that if they could get away with the mandates in Texas, they could get away with them anywhere. And sure enough, they got away with them.
Ready to roll?
Yep.
All right.
Real Texan.
Why should this matter to real Texans? Thanks for joining in this conversation with Real Texans, men and women who are doing great things to improve the lives of others in the Lone Star State. So excited to get to sit down with Mary Taylor Bowden, one of my heroes. I don't like saying that's a weird thing to say to a person, sitting here. And it's, in ENT, that not necessarily the stuff that you write, novels about. But yet you've been engaged in a fight for going on, 5 years now for the very strange purpose of being able to treat your patients and to treat your patients as individuals rather than as cogs in some, profit scheme for insurance companies and big pharma. When you started out, you were at Stanford, you were at UTMB. Then in your head, did you think, I can't wait to be a real doctor so I can go be deposed by the Texas Medical Board? Was that on your list?
No, not at all. I never thought I'd end up in this situation whatsoever. I sort of stumbled into the pandemic. As an ear, nose, and throat doctor, I'm very used to and very comfortable seeing patients with respiratory tract infections. Mm-hmm. So people started coming to see me, and I basically just did what I thought I needed to do. I didn't turn people away. I wasn't scared of getting sick. I got COVID multiple times and lived to tell about it. But I just used, and we all were searching for an answer, right? As a doctor, it was kind of scary because we're seeing this new disease and we're not sure what to do. And, some doctors chose to take the safe route and follow the government. And the government didn't see patients. The government had no firsthand experience, but I was seeing people and I used common sense. So I didn't know about ivermectin early on. I'd heard about hydroxychloroquine thanks to all the buzz around Trump, basically. Mm-hmm. And initially I started using that. And then the Texas State Board of Pharmacy shut it down. I mean, they prohibited doctors from using it. So then I just kind of put it on the back shelf. And this was pretty temporary, but I just didn't know because I was swamped. But then I used breathing treatments. I used steroids. I used antibiotics. And then monoclonal antibodies came about, and those worked great. I mean, I could order as many doses as I wanted. I'd have them in my clinic the next day. It was great. I mean, I probably treated about 2,000 patients that way. Government then took over distribution, became harder and harder to get monoclonal antibodies. And this was during the third and largest surge of the pandemic. So this was the summer and fall of 2021 when things were really bad. And this was when they were trying to push the COVID shots. So this is when I started using ivermectin, and that led to a lot of problems. I also spoke out against Houston Methodist Hospital, and that led to a lot of problems. And because of doing that and because of fighting for people and because of being vocal, I'm now still fighting the Texas Medical Board.
So I want to back up for a second. You're raised in Atlanta, Georgia, not Atlanta, Texas. Why settle in Texas? What brought you to Texas? You have four boys. What brought you to Texas in the first place?
Well, so UTMB, I started off at UTMB in my training, and they have the largest prison hospital in the state of Texas. Right. Excellent training. So it may not have the name recognition, but it's interesting because I did 2 years there, and then I transferred to Stanford because of my husband's job situation. And there was an opening, and it just kind of fell into place. But my training at UTMB was much better than my training at Stanford. It really changed my perspective on higher education and whatnot, because, you hear Stanford and you think, oh, the best. But
gold standard.
Yes. But UTMB, in terms of training, you had so much hands-on experience. So we moved out to California during the .com boom, and then we lived through the bust. And so when residency was over, I decided to move back to Texas. So that's how I ended up. And it's interesting growing up in Atlanta, I was still sort of partial to Atlanta, but now I would never move back to Atlanta. I mean, I love Texas now.
So, as Texans, of course, we all like to have the idea of, Texas, we're the land of liberty. We're the freest state. We're America's America, and all those kinds of slogans we like to say about ourselves. And, and in some cases, the marketing sometimes gets close to matching the reality. But that's not exactly what you found, is it?
Exactly. So healthcare, I believe healthcare is not consistent with the values of Texas, and healthcare dominates the Texas economy. I don't think people realize how much healthcare dominates the Texas economy. But Houston and Harris County, where I live, Harris County is the third most populous county in the country.
Right.
And we are home to the largest medical center in the world. I believe there are about 60 hospitals in the Texas Medical Center. We have the largest cancer hospital in the country. We have the largest children's hospital in the country. And then we are home to the first mandates for COVID-19 shots in the country. And so Houston Methodist on April 1st, 2021, declared that they were going to leading medicine. That's their slogan. So they were going to set a precedent and become the first hospital in the country to mandate the COVID shots. And this was actually 5 months before Biden. I mean, it's hard to believe that happened in Texas, and it should be a wake-up call. But I don't think people realize what is going on.
Now, so I want to be clear. You're not anti-shots. You're clearly not anti-medicine. You're not anti-drugs. You prescribe a lot of that stuff, right? Tell me what your concern at the time was.
Well, at the time, I actually had an open mind about the COVID shots when they came out. I personally didn't offer them to my patients, but I didn't discourage anybody. Initially. I thought, well, we'll see. And I didn't get the COVID shot because I wanted to see. I mean, this is a new technology. This is never done this kind of vaccine before. And we had no long-term safety data. And I was also seeing that we could treat people effectively early, and we could save people that way. Now, if I had seen, something different, then maybe I would have been more eager about those COVID shots. But I saw that we had early treatment and that it worked very well, because everybody that I treated, and I treated over 6,000 patients, everybody survived. So with these shots, I didn't, but what happened first is I was doing testing. And so I tracked people by their vaccination status. And what I saw was that the people coming in to see me who were sick, the vaccinated outnumbered the unvaccinated, and they were just as sick, if not sicker. So first I saw that these shots weren't working. And then I started seeing the carnage from these. I started seeing the side effects, the debilitating issues from these shots. So I looked at my new patient appointments in the 2 years following the rollout of these COVID shots. In the 2 years, 7% of my new patients were coming to see me for debilitating, chronic, life-altering conditions from these COVID shots. I've never seen anything like it with any other product on the market. If this had been a new antibiotic, it would have been swept off the market a long time ago. But what we were seeing, and of course we saw it with me, is massive cover-up, massive censorship, and that's just completely wrong. And then I spoke out about it, and here we are.
Okay, so you've been described by folks as an introvert, that you kind of like talking to your patients, you like doing your medicine, and then you like going home and being with your family. But yet most of us know you because you're very active on social media, you're out in the news, but a lot's been driven by them bringing a fight to you rather than you seeking this kind of publicity, than trying to seek this stuff. Again, did you have any kind of training in medical school about what to do when you're punished for treating your patients? Is that a course that you got to take, so you're drawing from, or is this all been trial and error, I guess?
Yeah, I mean, I hate public speaking. I make myself do it though. I mean, I've had to. There's been so many little challenges in the last 5 years. And yeah, no, there was nothing prepared me for what has happened at all. But yeah, I feel like I'm a lot stronger, and in some ways, I'm sort of glad it happened. But we'll see what happens.
So you said a moment ago that I think I've heard this before, but it certainly popped in my head just now. You said that of these thousands of folks came through, you've had 100% success rate with these patients, and it does kind of beg, I guess, the question, the whole point of your fight is, if something's working, why is the state of Texas, why is the Texas Medical Board, which exists as an agency with the people appointed by the governor, confirm all this, it's an agency of the state. Why are they trying to mess with something that works? Why are they targeting a doctor who is taking a look at their patients, prescribing a system of care? I mean, I guess if 90% of your patients were falling over dead when they walked out the door, maybe I think certainly we could understand that. But you're having the exact opposite.
Well, yeah. I mean, the purpose of the Texas Medical Board is to protect the population from dangerous doctors. And they've determined that I'm dangerous, which is not
because you're successfely treating patients. You're dangerous.
Right. So
dangerous to who?
Right. Dangerous to so I stepped on the toes of 2 hospitals. I mean, this is nothing. These complaints aren't patient driven, and it's agenda driven, and that's all it is.
Okay. So, again, something you said a moment ago, this idea of successfully treating patients. It feels like my father-in-law was a family practice doc, and it feels, and kind of his kind of shtick was, you talk to the patient, you figure out what's wrong, you take a look at their health, and then you tailor the treatment to match the patient. But it feels like today there's a big push when you've been kind of the fight against has been no, there's only one acceptable course of treatment. That runs in the face of what we know about human biology, doesn't it?
Well, there is an art. It sounds cliche, but there is an art to medicine. I mean, there is a reason that you go into a private room with your doctor and have a private conversation, and you don't just get on a computer and just leash out a treatment plan without. There's personalities involved. Some people are, very reluctant to take medications, and some people want to take medications as much as they can, right? and some people, they have different habits, or maybe they can't afford this one, but they can't. There's just so much to it. There are protocols or guidelines, but that's it. But what we saw during the pandemic is the protocols became the commandment, right? And there was this lack of flexibility, lack of critical thinking. And then people that spoke out just got persecuted.
So, setting COVID maybe aside for a moment, setting that aside, are you concerned that there is maybe a broader trend in medicine to turn doctors into little more than checkout clerks at the HEB?
Well, we've heard about AI, right? And this push to bring AI into the exam room, which I think is horrible. There's been a push to bring lower level, pharmacists now giving out the shots and giving out vaccines, and there's these clinics in the pharmacy. So yeah, it's concerning. There is a growing movement, though, of doctors like myself, and I call myself third party free because I don't take insurance, I don't contract with hospitals, and I don't contract with the government. The only people I work for are my patients, right. And that's called, I'm a specialist, so it's direct specialty care, but direct primary care is a similar model, and it's like affordable concierge care. So it's like the same amount of money if you were to join a gym, and you get much more time with your doctor, higher quality care, and you eliminate that third-party interference. So I see that as, I know Chip Roy has been talking about that, is pushing that. If we can grow that movement, that will go a long way in giving people options outside of this bureaucratic, protocol-driven system.
When you look at the state of medicine today, do you worry about what are young doctors, folks starting into their residency, what they're going to be dealing with in 10, 20 years?
Yeah, I mean, the medical students today are a lot different than the medical students when I was a student. DEI has been integrated into the curriculum. I have a pretty close colleague who was forced out of her academic position for her views on COVID, and she and her name's Dr. Rennie Moon. She's in Washington State, and she's having to sue the medical board. And but yeah, she, according to her, there's all sorts of things going on in our medical school curriculum, like the gender transformation. And then we saw the COVID hysteria. So that is worrisome. I'm hoping that, with the new administration, we're going to see a lot more pushback on that, but it is very concerning.
What advice would you give to someone, maybe an undergrad who thinks they want to be a doctor, someone who's starting out in medical school? What are the things that you would encourage them to be, either to be asking or to be inquiring about, or to at least be thinking about as they kind of step into American medicine as it is in the 21st century?
Well, I think I was drawn to medicine first because of my curiosity, which is the subject matter. And I'm naturally very independent. But if you are naturally independent, you might not survive in this current system of medicine. So I think you have to look at your personality and will you fit in with this? And there are definitely people that will fit in with that, and kudos to them. But if you are super independent, you might want to think about a different career.
So I want to go back to something you said a moment ago, which I find very fascinating, because it runs contrary to what we have been told of the last 40 years. You're third party free. You don't participate in insurance programs. You don't take government money. I think most folks today would say, well, how can you possibly run a medical practice like that? How can you be a patient? We've all been so trained, you're kind of forgetting that it wasn't that long ago. I mean, certainly in our lifetimes, when every doctor was essentially third party free. Right. And in this very short period, we have shifted to a situation where, you're the glaring exception in many ways. Whereas in the past, you would have been the norm.
Well, I think I'm a happier doctor. I mean, I spend more time with my patients. I don't know how these other doctors do it, like going in for 5 minutes with each patient. I just don't know how you do that. So I think I have a much better quality of work. And I probably make a lot less money, but I didn't start this practice to do it that way. I mean, I had 4 kids in 5 years. I took time off. I wasn't even sure I was going to go back into practice, but I decided once they got older, I would try it, but I was going to do it on my terms. And I just wanted to be a happy doctor. I didn't, and so it is more lucrative to either be employed by a big system and be tied into the system by far, is because I just don't see the volume of people that I would. And I don't have I can't negotiate with insurance companies and do all that. So, but, it's possible. And I think if I could grow my practice and I had other doctors with me, it would be financially better. But thanks to what's happened to me, no one really wants to join my practice. But yeah, it's definitely possible. It's just what your goals are. I mean, I think if you want to make, $6 million a year, like Dr. Mark Boom with Houston Methodist, then that's not going to be your practice model.
Right. So I want to touch briefly on what has happened to you. I think most folks who'll be watching this, know a fair bit about your story, but, you've had essentially the full weight of state official medicine come down on you. And in some ways it feels like you probably could have made all this go away simply by saying, oh, fine, please forgive me. I'll I'll do this couple of things and I'll just stop I'll stop serving my patients, essentially. Did you at any point ever think, well, I should just take the deal, walk away? I can be a slightly less happy doctor, but I won't have to be spending, a fortune in fighting the state. Did you ever occur to you to just give in?
No. No. Yeah, I mean, I did the ethically correct thing, and I was attacked, and maybe if they hadn't attacked me so hard, maybe they attacked me so hard that I just feel I have no choice but to counterattack harder until I win.
You wrote a piece year and a half ago now, talking about how big medicine has the potential to turn Texas blue. Explain that for me.
Well, so like I said earlier, it's, healthcare dominates the Texas economy. If you look on the jobs for Texas, the number one job is RNs in the state. Right. And it just keeps growing. And we've had this influx of people. The population of Texas is booming. And these people are coming from Chicago and New York and LA. And then they're diluting our values. And I feel like the fact that mandates started in Texas was very purposeful. I feel like it was strategic. I feel like they knew that if they could get away with the mandates in Texas, they could get away with them anywhere. And sure enough, they got away with them very easily. And it took just a massive effort to shut them back and pass the COVID-19 Vaccine Freedom Act. Right. But that act was opposed by the Texas Medical Association, which is the largest medical association in the country. The same medical association fought SB 14. So they fought the law against gender transitioning of minors. They have fought similar legislation protecting free speech for physicians. So I just feel like people don't realize what kind of influence the medical system has on our economy. They think of Texas as oil and gas, right. But I think people need to wake up and realize what's happening. This medical center, it brings in people from all over the world. It's the largest center in the world. And we've just seen what happened during the pandemic, and it should be a wake-up call.
So, not all of us are going to have a Mary Talley Bowden having a medical practice in our communities. What kind of questions should I, as a patient, as I'm looking for a doctor, as I'm looking for, maybe I'm switching doctors, whatever, what kind of questions should I be asking my physician, to get a sense of, are they there to protect me, or are they there to serve some, big pharma, big insurance company?
If they are still pushing the COVID shot on you, that's a red flag, and run. That's a litmus test in my head. If you have not, maybe I can forgive the people who didn't get it right from the very start. I mean, none of us did. But if you have a doctor that is still pushing the COVID shot on you, that's a strong litmus test that you were in the wrong practice. Similarly, if you see, that they still got their mask sign up in their office, that's a sign. You could ask them how they feel about ivermectin, another litmus test. They don't have to be, full on engaged in the whole COVID stuff, but if they have strong, anti-ivermectin stance, that's a sign that they're probably not open-minded. You can tell a lot by their staff. If their staff is happy and friendly, that's a good sign. If their staff is pretty abrasive or unfriendly, then that's also a sign that maybe the doctor is trickling down in that manner.
Excellent. Well, thank you so much for sitting down, having this conversation with us today. And thank you for joining this conversation with Real Texans.